can do it, but it's a shame on the product. I would say India. Yeah. Usually, yes, you do one hand, right? Per syringe. If you do hybrid, I would sometimes count your HA as also one filler. So a hybrid wash with radius, whether it's radius balance or radius revive, I usually do 2 syringes, the whole face. The neck, I do another batch because it's not enough to do the neck. And I do a second round of radius with revive. So it will be 1 to 3 hands and 4 syringes.
If the patient that which area the face, you can do radius for the neck?
Yes.
Different in the same time?
Yeah? Yeah. Lifting out, I would usually go mid-face with volume, jawline with intense. Beautiful. If you want. We can do yes. Unless you want to do pure radius, also possible. Radius pure, without hybrid, also good option, but the moment the skin becomes a bit more thin, hybrid is a bit more forgiving because you think it goes thick. But that's the difference. Last question, and I have to go that way, sorry. Yes. Yes. Both. But I will show you also on our rotation. I always keep 1 finger or half a centimeter approximately away from the labia fold and the magnet line and corner of the mouth, or else I will make it more heavy. Good question. Okay, guys, I'll sit on the other side.
I connect. Change. It's very long there. I will check there. But keep this one. Just a bit of hydration here for the eyes, not volume, just hydration. I think that will help you. Yeah? Okay. Okay, guys, can you hear me? I think you can, right? Shall we double check if they hear me? Because yeah? So, we analyzed her face already. A little bit. We see that she's got perfect skin quality. She has a little bit of issues around the eyes, a little bit a wish to maintain tissue quality without giving volume, because like she said herself, she has a slim face. If I volumize her, I'm going to really change her face too much, and this is something she doesn't want. So I have to be careful not changing the face. That's the primary goal. Not blowing her up too much. Now for that, of course, Radiesse is perfect in diluted form. If I use Radiesse pure, it will definitely give volume. Don't forget, Radiesse was put on the market as volumizer, and it has been used as volumizer for at least 20 years. Regeneration is something of the last 5 years, maybe 10 years maximum. So we use it in dilute form. How do I design my face area for skin quality improvement? I have the nose, I have the nasolabial fold, I have the marionette line, I have the jawline, and you see what I'm doing? I'm having the orbit line, also the zygomatical arch. What I'm doing, sorry? Revive, yes, please. And then I want to show them the foaming. I want to stay away from the dynamic areas. I stay away from the dynamic areas around the eyes. Of course, I stay away from the malar bag. I stay away from the dynamic areas. I'm also going to stay extra away to not enhance the nasolabial fold. What I do is I add a centimeter or half a centimeter extra, and here I'm going to stay away as well. I hope you can see it. I'm going to do the same drawing on the other side. So what is my treatment area? My treatment area is side of the nose, nasolabial fold, marionette line, jawline, preauricular line, zygomatic line, orbit line. Then I want to stay away, of course, from around the mouth, around the eye, and what I add is an extra, more or less, centimeter from the nasolabial fold, corner of the mouth, and marionette line to not enhance them, make them bigger. I don't want that. Now I'm going to improve this skin quality for her, and because she's young and she likes, young people usually like to have a bit of a glow on the face, and when I'm talking about glow, I'm always talking about Revive. Revive is beautiful for glow. So for that purpose, I could do her radius 1 to 2 or 1 to 1, I think maybe even 1 to 2 to not give accidentally volume. She would be an amazing candidate for 1 to 2 radius dilute without anything for tissue quality. But because she's young and she's an ideal patient for some glow, I will mix it hybrid with Revive, 1 to 2. Now what you see here, there it goes. I will try to remove the air a little bit. There it goes. So I've got here in total 4.5 cc. 4.5 cc. This is 1.5 radius, 1.0 Revive, 0.5 Lido, and 1.5 saline. I'm going to mix it a few times, maybe 20. There it goes. And now I'm doing the foaming. So what you see is I'm blocking this side. It's locked, I cannot move. I will aspirate on the other side. And now, because of the vacuum, the hybrid comes out on the other side and it looks like soap, like a foam. And that's what we call foaming. Other side, again, I block this side. I will create vacuum on the other side. And because of the vacuum, the filler will come out on the other side like foam. And this is the foaming. Why do I do foaming? I block and I aspirate. I do foaming because this decreases the risk for nodules. Why? Because what you see is that the foaming redistributes the particles in a more homogeneous way. So the particles will be more homogeneous after foaming. This has been shown on laboratory testing. And then I do some back forth again. So now I've got 4.5 cc's of hybrid 1 to 2 with Revive. I will put this back in a radius syringe and I will start treating her. I will have a 22 gauge cannula, 70 millimeter, to be able to access the whole face. I make a small entry point. Sorry for the anesthesia. There it goes. On the other side I will make some anesthesia as well. There it goes. Yeah, amazing. Thank you. And I want to bend. Can you give me the cap again? And the cap as well. I will show them something. I always like to bend the cannula so that it's easier to stay away from the hairs and make the angle. But what am I doing? I'm bending it in such a way that the hole is towards towards the fat. So I'm bending away from the hole. Why do I want the hole to be towards the fat? I don't want to push, because I'm going to scrape the skin, I don't want to push the product into the skin. which can happen sometimes. So I want to have the product towards the fat. I'm making my entry point. This should be comfortable for her because of the anesthesia. You okay? Very good. I will have her change the position a little bit, and I will have some extra gauze for under the cannula. And what I'm doing now is making sure, are you okay? I'm in the right layer. What does this mean? Sorry, don't want to be accidentally in this mass. And to do that, I'm stretching and pushing so that I push the cannula towards the surface. And you see I'm staying away from the no-go zone. And I'm injecting small lines of 0.1 cc. So just a little bit of product per line. There it goes, small amounts. There it goes. And like clockwork, can I have the marker? What I'm doing is like clockwork, I'm making lines and going all around the face. There it goes. I stop at the green line and I continue again. Next layer. There it goes. And you see I'm pushing. I'm not just putting my finger here. I'm pushing, stretching, and making sure that I can get the cannula to be in the superficial plane. And especially here, anterior to the masseter line, in this spot, the mass is very thin and the fat very spongy, so it's very easy to go underneath or in the mass. So I really have to be careful here that I'm not accidentally diving deep. So I really have to stretch and push well. And the thing is, the trick is, when we push on the tip on the cannula directly or indirectly, intuitively, this better? Intuitively, we would think that we push the cannula towards the deep, but pushing on the tip of the cannula decreases the distance between your finger and the cannula. So you bring the finger and the cannula together by pushing on it, and that will actually force the tip of the cannula to the surface. This principle also applies for liposuctions. There it goes. Now we go to the lateral portion. There it goes. Sorry. There it goes. I'll try to be back after the treatment so that maybe I can answer some questions that you guys have based on what you see now. But important things, you see that I'm actually maneuvering and controlling my cannula all the way while I'm working on this part of the face. She really has amazing skin, so it's really taking good care of her skin. And there it goes. And if you do this treatment well and you distribute the product well, what you will see, it will impact in a positive way the jawline, marionette line, and nasolabial fold. It will give like a small lifting effect, and the effect will increase in time as the collagen will be made by the particles even more, because this is a slow process. We will see the effect of radius usually, if you're lucky, at 6 weeks, and otherwise maybe only at 3 months. It takes time. Now we do the other side, same thing, same idea. There it goes. And this approach, using radius for the skin quality, is super powerful. And you see now in this young female patient, I added Revive to the mix to have this beautiful glow effect. If for some reason you want to combine the radius with an energy-based device, for example. And this is also the beauty of radius, guys. Why is radius so versatile? What can I do with radius? I can dilute it, I can hyperdilute it, I can hybridize it with all sorts of CPM fillers. I can use it in combination with energy-based devices or therapy, maybe even others. It's such a versatile filler. There's no filler on the market that is so versatile as Radius. There's also no filler on the market as a brand with so much scientific data as Radius. So Radius is super unique in that way. So it's super versatile, and like I said, it's not only for dilution or for hybridizing. You can also combine it with energy-based devices. But the moment that you use it with energy-based devices, again, the question is, how do you do that? And the moment I would consider using energy-based devices, like I said, then usually I do the Radius without hybrid. Why? Because we don't have enough data yet, but the impression is that the energy-based device will affect the HA, and maybe you will lose part of the HA effect because of that, and that's a shame. It's a shame for the patient, it's a shame for the treatment. So the moment I have a plan to combine, for example, with L-therapy, Radius and L-therapy, beautiful approach, powerful technique, then I will just go Radius dilute without hybrid. You see how very little I inject per layer. I prefer making more layers, more lines, than injecting thicker lines. I want to have a little bit of volume here and there. There it goes. And there it goes. A little bit of volume. Small lines of 0.01. Again, difficult area. If I'm not careful here on the cheek, I will dive deep. I really have to make sure that I feel that I'm in the right layer. How can I check that I'm in the right layer? Two ways. First, by just seeing how the cannula shapes around the skin and how it pulls the skin down when I pull down. Second, I want to hear a crackling sound when I'm going to the fat layer. The moment I don't feel a crackling sound, like walking through the snow, fresh snow, or like eating a cracker, that sound, if I don't feel that, it means I have no resistance. No fibroreceptor network. If I don't have fibroreceptor network, what it means, I'm in the SMAS. I'm one layer deeper. So if I move easily without the scratching sound, I'm too deep. I have to reposition and restart and put my product in the superficial layer. And you see, because I'm having a good dilution, because I'm in the fat layer. The fat layer, whether I'm deep in the fat or superficial in the fat, is the same superficial fat layer. There's only one superficial fat layer. So of course I don't want to have product visibility, but that's a matter of technique, of how much I inject per line, and especially we know that CPM integrates super good. So the moment I have a hybrid, it's almost impossible. It's really difficult to create a visible product because you can always massage it very nicely. It integrates beautifully and is super forgiving. And here, preauricularly, this area is also pretty tricky. Why? Because the resistance of the fat layer is more than the resistance of the SMAS, but also more than the resistance of the parotid gland. So if I'm not careful enough, I always say the cannula, we use it for safety, to create more safety, but the cannula is not my friend. If I let the cannula do what it wants, it will dive deep to the layer of the least resistance. It will go there where there's less resistance, like the SMAS, the parotids. And if I put my product in the parotid, then you get usually a lot of inflammation. So, like I said, it's not your friend. We use it for safety, but we always must be in control and make the cannula go where we want it to go. We must be in control, not let the cannula be in control, because then it will go in another layer. There it goes. We massage. I hope this was very clear and informative. And next, very good treatment possibility for somebody who's really focused on skin quality and not volumization is, for example, the neck. I could use the same, yeah, another syringe, perfect. I could use the same technique and the same mixture, this 1 on 2 with Revive to get glow, is also very beautiful for the neck. I will show you that technique. Make the bed higher. And you don't have to be afraid to get volume or get issues. Wanna look? You sure? It's looking very good. Okay, this is good. Chin up, look to the to the other side. So I will, to do the neck, I have the sternocleido as reference. I draw out the sternocleido. Yeah, perfect, thank you. I clean the area. I don't want to go behind it necessarily. There's not much benefit from that dorsal part of the neck. I will want to treat this whole neck area. I have a midline of the neck area, and I will make an entry point. Can I have it 2250. I'm using a smaller cannula now because with a big cannula sometimes it's difficult to make the angle around the anatomy of the patient. Very good, look more to the side. I hope you can see it. I make a small entry point. It's a bit sensitive of course with injection, but usually I inject more fluid here, again to create a bit of hydrodissection. I make a small entry point. I bend the cannula again, and again I want to bend the cannula with the hole towards the fat. So I'm going to bend it this way. I don't want the hole towards the skin, because what could happen is that I'm scraping the skin too much and I might push a bit of filler into the dermis. Now, here you see where I am, superficial. I'm doing a hybrid, so very good. I'm having this hybrid also in the neck to create some glow on the skin. I like to have her some glow because she's got such a good skin quality. And I do some retrograde lines. And you see how quickly and smoothly this can be done. And also here I use the technique of stretching and pushing on the tissues to make sure I control my product in the right layer. There you go. Are you okay? Yeah? There it goes. Retrograde line. Retrograde line. And like clockwork, I go all the way around. And when I'm finished, I will do the other side as well. Beautiful treatment for some skin quality and some glow. Yeah, the last one, last little bit.
Yes.
I will design the other area. I will stay out of this area, and then like clockwork I will treat the other half of the neck. I will do some injection for anesthesia, a little bit of hydrodissection. It's always a bit sensitive, excuse me for that, but she's doing very good. She's an amazing patient, amazing model. You can come back next time if you want. Always welcome. There goes. Entry point is here. Can I have the needle again? And you see, again, superficial, sub-Q. I really want to be in a sub-Q fat. I don't want to accidentally enter the deep layer. There it goes. Sorry. If there's too much resistance, I go around it. Clockwork. And you see that if you're used to it and you're doing this quite often, it's like a 2-minute procedure. I massage it a bit, and especially the neck I like to massage quite firmly. You okay? There it goes. Towards the cranial part, a little bit to finish up. And we're done. I'm going to massage it. And the way I massage the neck is usually really by rolling it. Massage and rolling it is not a nice massage. Sometimes massages are nice. This massage is not nice. The muscles in the neck are very sensitive, so the moment you grab them and massage them like this and roll them, people are really sensitive about it. But it's good to have the result because I like to do the massaging. I don't want the patient to do massaging at home. When I'm done, she should be done with massages as well. I do the massaging. So what have we done for her? This mother with an impeccable skin, very good skin maintenance. We gave her, she had some issues around the eye, and around the corners of the mouth. So giving some tension back to the mid face and the lower face is perfect for her to improve the area around the eyes, around the mouth, the lips, and the jawline. And the neck, while we're at it, we did the same thing. A beautiful combination for both skin quality and glow is, of course, the hybrid with Revive 1 to 2. Same dilution. Very good. Thank you very much. Yeah. You did amazing. Thank you very much.
لما محتاج شيء
Hope you enjoyed. Are there any questions? This fellow was first, and I'll come to you.
Just if you can review for us, what is a hybrid Revive, and what will be the dilution if we are using the radius, for example, for the definition of the jawline?
Okay, very good. So hybrid is when we add HA to the radius. How was it developed? Because somebody just tried it once, and almost simultaneously when Nabil and myself started working on it, we saw the benefit of hybrid was that there was somehow a bit more glow on the skin, and we saw that the patient was super happy with it because of adding the HA to the radius made the result more continuous. We know from radius treatments that we cure, and not for skin quality, but cure for the volumization, that the degradation of the CMC gel can be quite good before volumization with collagen, and then patients come back to you after 3 months and after it's gone. But if you come back after a year, you see it, then it's
Which
there.
HA you are talking about?
CPM. So you see that all the studies we did about hybrid, the data we know of safety and efficacy, we know it's safe and efficacy with CPM therapy. And why we think that it's so safe is that because of the good integration capacity of the CPM. It helps the safety. So we combine it with CPM. If we want to do skin quality, we will dilute it. I combine it with Revive or balance. If I want to use volumization or definition, if I want soft volumization, I do it only one-on-one with volume. I don't dilute more. If I do the jawline for sharpness, and in male, you don't need that. Why? Because I've got thick skin, I've got hair follicles, I've got beard. I will use radius plus, no problem, good result, good definition, and it will not show. Because radius integrates a bit slower than Velvera. If I've got a female patient, a bit older, thin skin, I need to do a big correction of the jawline. I will only do radius, I will have beautiful result, but I might have a little bit of swelling, irregularity for a few days. I do hybrid with intense, immediate integration, good results, and still a good definition. So you can play a little bit with it depending on the patient. The main message is if I use it for volumization definition, only one-on-one. The more I dilute, I will lose my definition of volume, so there's no sense. But I always add a half of lipo to make 3 cc. If I go for skin improvement, and for her, she had a beautiful skin, but she was a young patient, but she had a young glow, they want the Instagram photo, the Instagram skin. So what I did for her, I added Revive.
So for jawline, what did you add?
The jawline, I didn't treat for the
No,
jawline.
no, like,
In
what do you
theory, I
add?
will do one-on-one with the tens. The moment
Tens.
I go for skin quality, I can dilute more. Because I'm focusing on volume, I'm focusing on the quality of the skin. And for her, in her case, I did 1 to 2. 1.5, and I think in blocks of 1.5. Right? 1.5 yes, 1.0 Revive with 0.5 Lido, then 1.5, and 1.5 Sega. Blocks of 1.5. And this is very easy. If I've got a patient which needs to put more bulkiness, more effect, or I would inject twice as much, I could also do 1 to 2. But for her, the skin was already pretty good. And I want to, I can do 1 to 1. I can do 1 to 1 without Revive and Lido. If I want to have maybe less dilution, more firmer results. But for her, the 1 to 2 was fine, it's good enough. Some cases, you could do even 1 to 3, 1 to 4, but then adding the HA would only be useful if you're working on the neck, right? Because you want to avoid having a liquid. The moment I work on the body with higher dilutions, 1 to 2, 1 to 4, 1 to 5, I don't need to make hybrid because I don't have active muscles close to the skin. I have a good fat layer as protection, so I can use high dilutions for the body without being afraid of sedimentation or knuckles. So the logic for adding HA is not necessarily there. Where is the having useful? Neck, face, hands.
So the solution for the jawline, if I will use just red is what you
Now,
without HA.
Zero dilution.
Okay.
Pure red, yes. Yes, or 0.3. 0.3 as well. With the hybrid? Yes. I would avoid doing hybrids, for example, a third hybrid that I would defense. You can still do maybe hybrid volume. You do hybrid volume here, you could do a bit of hybrid volume here as well. Oh, as well, we can do that. No problem.
Your TikTok is legendary.
Inside. One hour difference. What I advise, if you have questions that were not answered, please give them to Ford and Jessica, and I will answer them on the mail.
Just one last question.
Okay, go ahead. Go
How
ahead.
many session radius you number here, especially about twice in a year?
Maximum twice. But
How
you see
many
the
syringes
particles,
per session?
1.
Okay.
Radius.
If the
Twice a
budget
year.
of the patient to do only one in a session, one radius in a session,
Yeah.
because sometimes we have to.
The thing is, you know the particles stay for 2 to 3 years. So adding every half a year, every 3 months, and every half a year is okay. But every 3 months that might be too much.
Even if it's one session, one syringe in a session.
Depends on the patients. Depends on the patients.
For this,
1 to 2. 1 to 2.
for this patient,
1 to 1. Hands 1 to 1.
you use one on each side for this patient.
Yeah, so actually I did 2 syringes together, so radius and Revive, and I finished it together each side. Guys, I'm very sorry, I have to leave. Thank you very much.
Yes.
First we will eat, then we will test.
Okay, but it's crowded now.
You also they have. You also introvert.
So,
Are you introvert?
sorry?
Are you introvert?
Introvert? What the meaning of introvert?
If extrovert, they don't have a problem.
Yeah, that should be the new problem. No, I'm not shy. But they will finish. Maybe have 5 minutes or 2 or 10 minutes, and we will go. We have another presentation, right? خلاص done? Ready? Okay, we can go. I think we have a lot of presentation, but that is we have here. It's open.
The teams, right?
Teams, right? Yes. Okay, can I try? It's okay. But you have the link?
What link? You sent it from
No.
WhatsApp.
No, this link for WhatsApp for YouTube, I send it. But they send another link. Okay, we will do a new link from here, and we will testing from our phones. It's good or not? Okay, we will take this one, and I will take this one from here. ايوه. Bro,